So first of all, I'm going to just put up on my screen my presentation. Hopefully you can see my slide, and I'm just going to put that on full screen. Oh, there we go. Just 1 second. Okay, so again, welcome to the Global Business School for Health. I'm Professor Nora Colton, the director of the school. Today, I'm going to be talking to you about scholarships and funding. So first of all, before I get into talking about the specifics of scholarships, I want to tell you just a little more about the school. First of all, we're the first business school in the world totally dedicated to health and education in the business space. A lot of the reasons why the school was established was because there was an awareness that we needed to have really much more health education in terms of healthcare management, leadership, to really address all the challenges that we see within society today. We're living through, a pandemic, and as we all know, it's really strained our healthcare systems. And every year, millions of people are impacted by their health systems across the world. Today, we see access to health and healthcare more important than ever before. And much of that is driven by the fact that we have demographic changes, that we have people living longer. And so we have an aging population. And that's not just in Western countries. We see other countries where that pyramid will soon kind of flip, and the vast majority of the population will be those in their 60s or over 65. So that's really important because as we age, as we all know, we tend to have more health issues and challenges. The other thing is non-communicable diseases such as stroke, cancer, diabetes. They're impacting more and more people across the world. And that includes low and middle income countries, often who haven't historically been in a position to invest as much in their health and healthcare systems. So this is a really important area. And we see that, countries, even Western countries, are spending over 10% of their GDP in this healthcare space. Some countries spending almost up to 20% of their GDP in this healthcare space. And also we see a number of countries, in economic development, we used to talk about the catch-up effect, countries that were spending money to catch up to other economies by growing and investing in industrialization. Now we see the health catch-up effect. We see lots of countries across the world that have very low investment in their healthcare systems, putting more and more resources into it. So it's not just about putting resources and money and costs. It's about how we manage, how we lead, how we think about our health systems. So much of what we do at the Global Business School of Health is really take a fresh, renewed kind of look at our healthcare systems. We need to reimagine them. We can't train up enough doctors and nurses and other clinicians to really address the healthcare need. We need to use technology and digital technology, moreover, in more ways as we go forward. So that's really a very important part of what the Global Business School for Health is about. We also have a number of programs within the Business School of Health. Of course, we have our flagship program, which is our MBA program. Again, really novel, innovative program taught in block delivery. So students get a real integrated block of learning over 4 weeks for each module. They take different subjects in, business and management. So it's got everything you would expect in an MBA covered across the academic year. It's a 12-month program. And but what really makes it stand out is health and healthcare are integrated. So all this case studies students do around strategy, marketing, finance, all have a health angle to them. We also have teams of individuals teaching each module. So you have people from the health kind of side as well as the business and management side. It's a fantastic program. We also have another really novel program in biotech and pharmaceutical management. Again, something that's really needed as these areas rapidly grow and progress. And that program is really focused on the kind of business dynamics, the sector itself. You do things like supply chain management, you get clinical trials and statistics. So it's a fabulous opportunity to really learn about the business side of those sectors. And then, of course, as I just mentioned, digital health is where things are going. So we have an MSc in digital health and entrepreneurship, a real focus on startups and people who want to innovate and be innovators and really make a difference in the digital health space. And then last but not least, we have our MSc in global healthcare management. And we've designed that so that you not only get a real grounding in management and healthcare management, but you also have an opportunity to specialize. And we have 3 specializations, one in analytics, one in finance, and one in leadership. All of these programs are fantastic. And one thing they all share in common is a real world kind of sense and approach to really rethinking and reimagining healthcare. We have projects, group projects in every one of our programs. And we have opportunities for students to work with industry, people in the healthcare professions, to really mentor them as they do these projects. We also have a wonderful program called Health Executives in Residence, where we've got over 25 senior leaders, CEOs in healthcare organizations who have agreed to have office hours with you every term, to come in as guest lecturers and speak in your courses and really give you career advice and be accessible to you as you start your journey in this kind of healthcare management space. So of course, one of the most important things as a student is, first of all, what is the admissions criteria in getting into the program? But then there's also the worry about how am I going to afford it? How I'm going to pay for it? So that's what I'm going to spend most of the time today talking to you just about how you put together, the kind of finances around doing such a program. First of all, we have our MBA Health. It costs $45,000. It's a very competitive MBA. Ran over 12 months if you do it full time, 24 months if you do it part time. So there are many ways that you can structure the finances around this. If very few of us actually have 45 grand that we can just, take off the shelf and put into the program. But if you do, that's fantastic. If you don't, you can look to scholarships, loans, and also, working alongside doing your program. The other thing is you might talk to your employer. Many employers fund MBAs. And then we also have our master's degrees that I just talked to you about. Again, if you're a UK student, so $16,500. If you're an overseas student, those are $29,400. And again, they run duration of full-time. You can take them part-time, and some of them you can actually take them flexible. So we've got lots of options for how you can take the program and also, how that'll impact your finances. And then, what's included. So here's an example of how your finances, your payments will be structured. So what's included into your fees in most of the programs, you'll get your study materials, your registration, your tuition, exams, resits, your graduation. If there's any meals or activities that you have to do. So for example, in the MBA, they have a global health challenge overseas module. It excludes the accommodations and flights to that. It's a 2-week experience abroad, but we cover all the activities and the ground transportation, as well as the meals on the ground. So, it's important to understand the full cost of the program and how it works. If you do the MBA Health as a part-time student, you pay $7,500 across 3 payments in the first year and 3 payments in the second year. So a total of 6 payments. If you do the MBA Health as a full-time student, you pay three payments. Those are $15,000 each. So if you're doing a master's program, if you're a home student, again, you'd pay 3 times over the year if you're doing it full-time, and 6 times if you're paying it as a part-time student. And the same applies if you're an overseas student. So you can figure out what your kind of payment schedules are. Normally, the first payment is at or before enrollment. The second payment is in February, and the third payment is in May. And there's no charge made by UCL for paying in installments. The other thing you need to think about if you're coming from outside London or you're coming from abroad is you have to think about what are you going to be your weekly expenses. Now, this can sometimes be really difficult because people have different preferences. Some students can manage on a lot less, and some students need a lot more. So I know a number of students, they would tell me 31 pounds a week for food is quite a bit. I have other students who would tell me that's not enough. So this is just approximation. I would say probably between 200 and 300 pounds a week, depending on your preferences, with an average of about 250 pounds. So again, you can think about rent. There will be, all our master's programs are going to be taught at UCL East, which is in Stratford. There is student accommodations that UCL has built there that students can apply to. There are also private student accommodations throughout London that you can look to. And there's also different parts of London with different rental rates. Often students will share a house or a room in a house, or you can find just other individuals across London who are willing to share accommodations. So your rent can vary quite a bit depending on your lifestyle, what you want, what you have to have, what you don't have to have. Okay. And then again, depending on where you live, your bus pass can be more or less. Course materials, they'll usually be pretty much provided for you. So they're not going to cost you a lot of extra money. We'll have digitalized and put everything, if there's cases, for example, that you'll do with your program, those will already be part of your course pack and provided for you. Of course, like everyone today, we all need a mobile phone. So that's another about four pounds a month. And again, you can look for different packages. So going out, 12 pounds a week for some people, that's about right. Other people might need to be a bit more, and then clothes, and then, health and other things. So these, again, are about approximations, but it's important to get an idea of what it might cost to live in London. The other thing is, now moving away from your expenses, your tuition, how it's paid, how the installments work, and then, your living expenses if you're coming from outside of London. What are your funding options? So now we'll turn to look at those. So we've got some scholarships. I'll talk to you about them in more detail in just a minute in the Global Business School for Health. There are also UCL scholarships and bursaries that you can check out. If you're a UK student, there's government loans. There are also other loans and other funding options. I'll talk about those in a minute. And then there's, of course, additional support that you can tap into. The other thing is there's always opportunities to work, to have jobs alongside your studies. And I'll mention those just a bit. So there are 3 really main scholarships that were offered this year. I am going to talk to you about a really exciting scholarship that's come forward for our MBA that I think some of you on this call might be interested in. The 3 scholarships that we have currently is the MBA Health Future Impact Leader Scholarship, the Women's Healthcare Leader Scholarship, and the East London Healthcare Leader Scholarship. These are really about targeting different groups to provide, opportunities for them to participate and be a part of our school. So the first one I want to talk to you is about the MBA Health Future Impact Leader Scholarship. This is open for UK and overseas students. You can get up to 15,000 pounds on your MBA. We are offering quite a few of these, so I would really encourage you to apply for the MBA and apply for this scholarship. We're really looking for exceptional students. You have to apply for the MBA, so you can apply for the MBA and apply for the scholarship simultaneously. The deadline, by the way, for all of these scholarships is March 31st. So please, get your applications in straight away. Once you're accepted, you need to be accepted into the MBA to be awarded the scholarship. We'll be looking to award those scholarships in April after the closing date of the scholarships. And you can, apply to the MBA at this time. Applications are open. We've started interviewing candidates, and we've made some offers now. So, what you have to do is, in addition to applying to your MBA, you submit a 500-word essay that really articulates how you're going to make a difference in healthcare management when you complete the degree. I want to talk to you also about another MBA scholarship. This is really new. It's something that we're going to be going out in the next week, really promoting. If you're from the UK and you're from a low-income background, you're either from a BAME background or you're a female, you can apply for this scholarship. This scholarship is offered through ROCHE, who is a pharmaceutical company. The person who gets this scholarship, they're offering one full MBA health fees plus 20,000 for living expenses, plus the student will be able to have an internship at ROCHE along with mentoring. This is a phenomenal opportunity if you meet the criteria. And again, the criteria to be eligible is you need to come from a low-income background, you need to be from a minority ethnic background, identify as a female, and live in the UK. So if you meet that criteria, and you you can either be BAME, male or female, or identify as a female. If you're from one of these underrepresented groups, you can definitely apply to this scholarship. And it is a fantastic opportunity. But as with the other scholarship, you need to be able to apply and get into the MBA as well to get the scholarship. We also have another scholarship. And of course, I'm really cognizant that in another week, it's Women's International Day. And one of the sectors is health sector. We see that there's really underrepresentation of women at the top table in the senior management teams. So we've created this scholarship specifically for women who want to really, further their opportunities. So on this particular scholarship, and again, this one is open to international and UK students. You can also, by the way, apply for this scholarship and for the MBA scholarship and combine them. So this is a great opportunity for females and those who identify as females to really hone in their leadership skills and also get a 5,000 pound scholarship. So you have to be female, you have to apply to either the MBA or an MSc, so you can get this scholarship if you're applying to an MSc. A strong overall application, and you need to submit a 500-word essay, again, by the end of March 31st, for the scholarship. Also, by the way, March 31st is the deadline for the MSCs. The MBA will have a later deadline in June. So do apply and get your application in. The next scholarship, again, is really targeted towards where we're moving. So we're going to be located at UCL East in the fantastic Queen Elizabeth Olympic Park. And in honor of that, we have created a scholarship for health professionals in East London. It's up to 5,000. You can put it towards your tuition. Again, it's the same process. You can use it for the MBA or the MSc. You do have to complete a 500-word essay. And it's for people who either live or work in East London in the health sector. So those are the scholarships that we've got available within the school. As I've mentioned to you, other than the ROCHE Scholarship, which has a slightly different process, and we'll be putting that up on our website shortly, you have to write a 500-word essay. You send that to our admissions inbox, and you have to apply to the program. You can't be awarded. You can apply for the program, the scholarship, excuse me, before you get in the program, but you cannot be awarded the scholarship and until you've been accepted into either the MBA or an MSc program. If you want to know more about these, just write our admissions inbox. We'll answer any questions you have. Again, I can't emphasize enough. The deadline for master's is March 31st, and the deadline for applying for the scholarship is also March 31st. You can apply for the scholarship and for the degree program at the same time. You won't get awarded the scholarship unless you're also admitted into the program. So now let's look at some other bursaries. So that's what we've got in the school. And of course, we're constantly looking to add more scholarships. And if we do, you can be assured that we'll let applicants know that. But at UCL, there are other opportunities. Again, UCL has their master's bursaries for students from low incomes here in the UK. It's up to £10,000. There's the Professor Sir Malcolm Grant scholarship that's for UCL alumni, up to £25. The Thomas Witherton Batt scholarship, again, for people in the UK for doing MSCs, up to £10,000. International fee partnerships. So again, there's the Chevening, the Commonwealth, the Contact, the Fulbright. All of these are scholarships. If you're abroad, you should visit the British Council in your country and find out what's available for you to study in the UK. And then I've just mentioned our department scholarships. There's also a great tool that UCL's created. It's really easy to use. It's called the UCL Scholarship Finder. You can go in there, you can put in your details, that you're a prospective student, the year you're planning to come, whether or not you're undergraduate, taught graduate, what department you're interested in, and it will help you identify scholarships that are available for you. There's also, if you're a UK student, you can get a UK government loan up to a maximum of $11,570. If you were to also apply and get one of those £5,000 scholarships that I just mentioned, that pretty much would cover your tuition to do a master's with us. And though it can be for taught and research masters, it's full-time, part-time, and distance, but not flexible. Flexible is when you do 3 to 5 years. It's for residents in the UK. You have to be under the age of 60, and repayments will be concurrent with any undergraduate loan you might have. Currently, the repayment interest rate is 6% of income over 21,000. So once you reach kind of an income threshold, you'll have to start to pay this back. There are also other funding options, and this is really important. So if you go on to the UCL website, you'll find a doctoral skill development program too. So if you see where it says human resource, learning development, learning academy, research development, doctoral skills development program, write that down, access that site. Given that you're a prospective student, you'll need to put in the PIN 3098. Now, why do I want you to look at that database? Because that database has funding opportunities from charities, other organizations. So it's not just for doctoral students. It's used mainly by doctoral students, but you'll find all sorts of opportunities, foundations, charities that you might reach out to help fund your postgraduate studies. So I highly, highly recommend that you take advantage of that and look at that database. It's got loads of organizations and charities that you might never have thought about contacting to help fund your postgraduate education. And also, if you see an organization that you feel you're not quite there, but you feel they should be funding you, don't ever hesitate to write to those organizations and tell them why you think that. There are many organizations and charities and societies that would be keen to fund students, but they might not be aware of either the program you're doing or your background or who you are. So bringing yourself forward and telling your story can be an important way of identifying funding. I just want to take now another moment and tell you about some other ways in which you can fund. We've talked about student loans here in the UK. There's also other mechanisms, at UCL. Of course, there's emergency loans if you're a student at UCL, and financial assistance funds. But and those are really only available once you've enrolled at UCL. If you're thinking about doing a PhD, there's doctoral school fellowships, and you can apply to those. Student funding welfare support. There's also postgraduate lenders. So two that are out there, LendWise, Future Finance, they offer loans, particularly to students doing MBAs. And then there's, of course, the overseas bursaries that I mentioned to you. And again, contact the British Council, look on their website in your country, and you'll find that there are many scholarships that they have available. Now I just want to turn to really working during your studies. Many students and postgraduates in particular work during their studies. I've had a lot of companies come forward asking me about hiring interns from our program. So once we get started and you're admitted, we'll have a job board and opportunities. We'll make sure that we get out to our students, companies and the names of companies that are looking for internships and how they can apply. There's also, it doesn't matter if you're a home or international student, you can take advantage of those programs. As an international student, working while you study can be a great opportunity. It can often lead to a permanent job. For international students doing any of our master's programs, they have the opportunity to get a post-study work visa, and I'll talk about that in just a minute. So working part-time and establishing yourself in the UK labor market is a very good idea. You can work up to 20 hours a week, Monday to Sunday. And then, of course, during the summer term, you can work full-time. At UCL, if you go to the website and put in UCL International Student Support, you'll see we have a team there that helps international students settle into life in the UK, make the most of their experience at UCL. There's lots of practical advice on that site as well around visas, immigration, and these sorts of questions that often as international students you have. There's also, as I just mentioned, if you come as an international student, you can apply for what they call the graduate route, is a visa available to international students who successfully complete a degree either at the undergraduate or the postgraduate level. You can then kind of convert your Tier 2 visa into the graduate route, and it will allow you to stay up to 2 years in the UK to pursue work. Other things I just want to mention quickly before I get to your questions is, as I said, you can go, if you type in funding UCL GBSH, you'll find our scholarships, student funding at UCL, PG loans for masters, if you're a UK resident, are available. And then there's also independent financial advice that you can get also through the UK. And then last but not least, I just want to flag up to many of you, you might want to come right after this and join an event that I'm going to be hosting immediately. It's called Health Innovation Through Capital and Private Equity Markets. If you're interested in this space and you're interested in the Global Business School of Health, you'll find this a really interesting event to attend. We also have other upcoming events. On the 4th of March, we'll have an open day online for our UCL MBA, so you can learn more about that. And we'll have later on in March another funding and finance event. So that's really all I have. I'm now going to turn to your questions. I can see that there's one question in the Q&A. I really encourage you to ask questions. This is your moment. I'm here to really help you, support you, not just to get into the program, but make the program a reality by getting the funding that you need, by structuring together different pots of money, as well as thinking about how you can work alongside your degree to make it a reality. So I'm going to go to this question. What are the career opportunities for an MBA Health? That's a great question, and I can tell you exactly. There's been a number of articles written recently because actually MBAs in health are one of the kind of hottest areas out there. There are many opportunities for anyone. And it's not just about working in a public hospital. There's opportunities, particularly in consulting, all the kind of big four, KPMG or Ernst & Young, Price, Waterhouse, the opportunities are immense. And there's pharmaceutical companies, like I said, Roche is providing a scholarship. That's because they're really keen to have students from our MBA Health come and work for them. So there's biotech firms. You can go into financial markets. As you'll see from the event that's taking place after this, most of the speakers are people who work in finance around health, and the MBA in health tees you off for that. So the opportunities are just limitless. And of course, you can also go into a startup, digital health, and you can go into hospital management and leadership. So health is really such an integral topic. And, we talk a lot about climate change. Climate change is having a tremendous impact on health and healthcare. More and more people will be accessing those opportunities. So lots to say. Also income levels, and recently an article was written. Some of the top MBA programs now see that health is one of the major drivers for their graduates. So it's a great opportunity and a fantastic program. Is it possible to get full funding support for the program if you're based in Africa? Well, we don't offer currently a scholarship specific for someone from Africa, but you could apply for 15K. And then there might be other opportunities, other scholarships that you might find from other organizations and funding. Also, you should probably contact your Ministry of Health and also your education ministry. Find out what scholarships, if you got into such a prestigious program, how can you combine it with other scholarships? So you might get, for example, if you're applying to the MBA, you could get the 15,000. And you could then look to see what other scholarships you might be able to bundle it with. And also, of course, you could look at loans and working while you're a student. I think really my advice is there's very rarely one place that you can find everything you need. Normally, what you need to do is think about how you can kind of structure your finances and how you can put them together in a way that then offers you a package of finance, rather than thinking I just have to get one funder, one source to fund my education. What are the statistics for international students in getting sponsored tier 2 visas? I don't know actually what the stats are, but I do know that the UK government now has in place this post-study work, which is a great opportunity. It gets you 2 years. And as someone with a master's, that should open up lots of opportunities for you. I would imagine, as you go forward in your job and what you're doing, a lot of it will contingent upon you. So do I know the exact stat? I don't, but maybe you could find that by looking at some of the government sources. I'm sure that they have that information somewhere. I would like to ask when we can get the results of the application for the GBSH Women Healthcare Leaders Scholarship. We will review the applications in the first part of April. So by mid-April, by the second week of April, because the application deadlines doesn't close till March 31st. We don't want to give out any scholarships until we can see all the applicants. So once the applications have closed on March 31st, we'll look at those applications in the first week of April, excuse me, and we will get back to all the applicants by middle of April so that they can make decisions. Thank you. Besides the MBA, do you also have an executive MBA course? Again, a great question. We don't have one for 22-23, but if you're looking to go and do your MBA in 23-24, we do have an executive MBA. We'll be launching it in the next several months through our MBA events, and you can do that. It's mainly online. It runs across 2 years. There's a 1-week residential you do in the here, and then one abroad in the US as part of your executive MBA. It's a fantastic program. So, watch that space. So we have our London-based face-to-face MBA that I've spoken about, and we'll have this executive education, executive MBA starting in 22-23. Is it possible to connect with alumni of MBA program? We are really just launching this program. I can definitely connect you to alumni at UCL, and we've got lots of endorsements, and we've got people who have taken the program going forward. We can look to see how we can get some of our alumni to talk to you. Just send us an email and we'll put you in contact with some people. Unfortunately, as my friends are currently on graduate route visas, they are unable to find a sponsored visa. I'm not sure that I quite understand, and it could be a lot to do with their experience and who they are and the kinds of jobs that they've taken. So I think really it's a lot depends upon the candidate, their background, the sector that they go into. I can't speak directly to your friend's experience. Can you apply for full funding support for the program while you're working full-time in the NHS? Well, I think if you were going to do this program and you're working full-time in the NHS, I assume you do it as a part-time program. You'd need to also, of course, have your employer involved. So again, I'm always happy, and we do set up one-on-one discussions. So if you've got some specific questions or want to have a one-on-one setup, again, just write to our admissions mailbox and we can set that up for you. How likely is it possible to get an unconditional offer on the MSc? Well, if you've already completed a bachelor's degree, you meet all of the criteria and you get an offer, that would be an unconditional offer. If you haven't completed your bachelor's degree, you will get a conditional offer until you can document that you've completed the degree. Can a master's in biotech and pharmaceutical management help me get into the director board in a company? Well, I think it would be a step in the right direction. I don't think it would instantly move you out of that, depending on your background, of course. I don't know what your experiences are previously. You want to do the biotech and pharmaceutical management MSc if you're really interested in doing and working in the business and management space. So what kind of jobs would you do? You'd do product development, You might do strategy. You could do supply chain management. You could work as a manager overseeing kind of the whole, from kind of bench to market, as it were, taking products through clinical trials and beyond. This is really about upskilling people to be in those management roles. And then, of course, they can also lead to senior roles. There are many companies, by the way, small startups, they're constantly looking for directors on boards. Of course, if you had a biotech and pharmaceutical management degree, it's going to make you much more competent for those. So if that's what you're referring to, yes, I think it's a start in the right direction. I'm not sure I can guarantee. You'd have to, have other things that company's looking for and experiences, but it will definitely start you on that road. When is the MBA Health program starting? It's starting this September. So we're taking applications now for that program. We hope to continue to take applications over the next several months. If you're interested in applying for our MBA Health, again, we welcome to give you the opportunity to have a one-on-one, any support you need on the application process. We're really excited to have this MBA in Health launching. We've already taken some excellent students. So as we build the cohort, there's many opportunities for students to join the class and be part of this dynamic program. How valuable is an MSc course in biotech and pharmaceutical management for a person who just graduated biotech 1 year back with a minimal work experience? I think it's a great opportunity if you want to get into really, as I said, the business and management side of it. You will learn a lot. When you take that biotech and pharmaceutical management, you'll get clinical trials and statistics, pharmacoeconomics. You'll learn about the kind of policies and practices in the sector. You'll also have the opportunity to do supply chain management, capital and private equity investment in that sector. And you'll have 2 courses on commercialization of research ideas with a focus on biotech, and commercialization in terms of pharma and marketing. So I don't think anything there probably replicates what you did in your biotech program. It's taking you into really the business and management space. So if that's really where you want to end up, then I think it's a fantastic program. In fact, actually, people with biotech and pharmaceutical backgrounds at their undergraduate are ideal candidates for that program and for the opportunities that it has. I'm currently an executive in QA, and I want to get in business development and strategic alliance. So I would suggest then that you do our MBA Health. I think it would be ideal for you. And allow you to really fill the gaps in your previous education and get the opportunities that you're looking for. Again, if you want to talk about that more and set up a one-on-one, we're very happy to do that. And then thank you very much, September 2022. Okay, well, look, I've really enjoyed talking to all of you. Fantastic questions. Like I said, we're really here to support you and to empower you and make sure you make the right decision for you and the right investment, and are able to structure your funding and your finances and your scholarships in a way that make these programs doable. So if you've got any other questions, please do not hesitate to reach out to myself or the team, and we'll set up a time to talk to you. But have a great afternoon. Join me now in the next room for a great session on private equity and capital markets in healthcare. Take care, and thank you, Rashish and others. It's been fantastic. Bye.